Welcome to the Villain's Clinic, where the only thing we murder is mediocrity. I am DKA, cursed to teach medicine with sass, sarcasm, and systolic murmurs. Sit back, med students. Time for your weekly dose of dark academia meets ECG. Well, well, well. If it isn't the future clinicians of the world tuning in to get schooled by the medical villain you didn't know you needed, but now can't survive finals without. Sit down, put that double espresso down, and focus. Daddy is about to drop cardiac chaos on your cortex. ACS is basically when your coronary arteries decide to gatekeep blood from the heart because of some drama caused by an atherosclerotic plaque rupture. It includes STEMI, the final destination of heart attacks, NSTEMI, budget STEMI, and unstable angina. It's giving I almost ruined your life, but not quite. He concluded by comparing it to Love Island, but with cholesterol. Non-modifiable, age 50. Congrats, you're old and it's downhill from here. It's male sex, because patriarchy comes at a cost. Family history. If your dad's heart exploded at 55, yours might too. Ethnicity? South Asians, welcome to the high-risk VIP section. Modifiable. Smoking, HTN, diabetes, hyperlipidemia, stress, booze, big belly energy, and exercise-ophobia. Basically, if your lifestyle looks like a pizza delivery receipt, we're talking premium risk. So here's how your arteries become drama queens. Endothelium gets irritated, like me when someone calls EKG instead of ECG. LDL moves in like a toxic X. Macrophages eat LDL, become foam cells. It's giving, let me just ruin my own life. Smooth muscle forms a plaque because no villain works alone. Eventually the plaque bursts like your last situationship, blocking blood flow faster than your crush ignoring your DM. Symptoms: chest pain, tight, crushing, dramatic. Like my standards. Radiation to arm or neck. ACS wants attention. Dyspnea, because breathing is optional now. Nausea, sweating, palpitations. It's a full-blown breakup but in your chest. Atypical symptoms: epigastric pain, fatigue, syncope. Especially in diabetics, the elderly, and women. Because the heart loves to gaslight. The patient will look like they just read your medical tuition bill. Sweaty, anxious, cyanotic. Check. BP, high, low, who knows? HR, tacky like your third coffee, or Brady if it's inferior, MI. O2 SAT, probably dropping like your motivation. Next, we examine the ECG. Let's make it visual. Hyperacute T waves. Blink, and you'll miss them. ST elevation, the drama has arrived. Inverted T waves. Heartbreak, now in waveform. Q waves, the X that won't go away. STEMI criteria. Persistent chest pain, plus ST elevation in 2 contiguous leads. Bonus points if it's in V2, V3 or LBBB, DKA explained. Here's how it's managed. The initial steps are as follows. Aspirin, chew it like your life depends on it. Oxygen, if SpO2 is less than 94%. Morphine, only for actual pain. Nitrates, unless hypertensive. For STEMI, PCI within 12 hours if possible, otherwise thrombolysis. After that, dual antiplatelet therapy is given. For NSTEMI, unstable, risk assess with grace, angiography and PCI as needed, anticoagulants depending on access site. But even after treatment, complications can occur. ACS is petty. Even after treatment, it might rupture papillary muscles, create aneurysms, kill via arrhythmias, give Dressler's syndrome, cause cardiac arrest. Worse with age, heart failure, renal dysfunction, ST deviation, cardiac arrest on arrival. Basically, if you show up looking like a Grey's Anatomy finale, your odds ain't great. And that, my tragically beautiful interns, is acute coronary syndrome, a heart attack with main character energy, DKA explained. If you liked this, drop a like, smash that subscribe button harder than the plaque hit the LAD, and remember, I diagnose, I dissect, I drag. Now, go forth and study, or cry, preferably both. I shall roast 3 comments. Will your mediocrity entice a response? Let's see, shall we?